Recent surveys say Asian Americans are reporting increased harassment and discrimination during the pandemic. This comes as many work on the front lines caring for COVID-19 patients. For one group, the virus is taking an outsized toll on people of Filipino ancestry. They make up 1% of the U.S. population, but more than 7% of the nation's healthcare workforce. And according to ProPublica, 1 in 4 Filipino adults in the New York, New Jersey area works in the medical field. Elaine Quijano shows us how the community of caretakers is coping.
As my sister-in-law was saying, we could probably build a hospital or a clinic by ourselves.
From nurses to therapists to doctors, Nina Batayola jokes there are so many healthcare workers in her family, they could fully staff their own hospital. Nina and her husband, Don Ryan Batayola, left the Philippines in 2007 to work as occupational therapists in the U.S. Then, in early March, they found themselves on the front lines of the pandemic.
And then in late March, he started to get sick.
I finally called the emergency 911 on him. He couldn't even drink water anymore.
Days later, Don Ryan was well enough to FaceTime from the hospital.
We were very hopeful. He looked much better. He didn't like the food. So I said, okay, think what you wanted to eat. Call me back and I'll have it delivered. He never got to call me back. That was it.
On April 4th, Don Ryan Batayola passed away in New Jersey at age 40.
We thank you for welcoming Don to thy gates in heaven.
His family paid their respects in an online service.
You were missed while you were gone.
He's one of more than 50 Filipino healthcare workers who have died from COVID-19 in the New York, New Jersey area alone, according to ProPublica reporter Nina Martin.
In 1898, the Philippines, which had been a colony of Spain, became a territory of the United States. It became one of the places that the U.S. saw fit to exploit labor from. They basically created a workforce that has turned the Philippines into the largest exporter of nurses in the world.
Many Filipino-American healthcare professionals work at the bedside or in critical care, the kinds of jobs that make you most vulnerable in a pandemic. Filipino-American nurse Jem Scorp works in the ICU at Elmhurst Hospital in Queens, New York, once the epicenter of the epicenter.
Have you been there in some people's final moments?
Exactly. I have a COVID patient. The wife was calling. So, of course, nobody will touch the patient. So I told the wife, I'm not seeing my wife. I'm not seeing my son. So this husband of yours right now is my family.
For months, he stayed at a hotel so he could keep working without infecting his wife and son. Family reunions looked like this.
It must be so difficult. I can't imagine being separated.
It is. It's not easy. Emotionally, it is.
Nursing was Jem Scorp's path to the American dream. For Nina Batayola and her 2 children, Erica and Enrico, that dream endures.
Even in this painful moment, do you see an American dream for them?
Yes. Yes. I have a dream for them. It might not be the same American dream that I had before.
Don Ryan Batayola loved sneakers, Bob Marley, and of course his family. Nina and Don Ryan had just attained part of their American dream. They both became U.S. citizens last year. And Gail, as an American of Filipino descent, the story reminds me of my aunt, my Tita Butz. She is a nurse in the Chicago area. And for her and so many other healthcare workers of all backgrounds, it's really a calling to risk your own health each day to help strangers in need. And Gail, I've heard you say it time and time again on CBS this morning. We are all so grateful to all of them.
We really are. I mean, these are truly the frontline people. Then I was thinking, when you think about the Filipino culture, is it very common that people want to go into the medical profession, Elaine?
It is. It really is. And there's also this sense of hospitality, which is very much part of the culture as well. One thing that you'll hear people talk about is that they always have a smile on their faces when they walk into a patient's room, because to them, that patient, and especially in this time of COVID, with no family able to visit, that patient becomes their family. So this idea of hospitality, of family, of caregiving is really part